I'm Molly from Girl Scout Troop 1936, and you're watching the Cookie Channel.
Now that everyone's here, I have some bad news. You need a new kidney.
Do I have to give my kidney?
Can you do TikToks with only one kidney?
I need mine for Renegade. Renegade.
How did I do it?
When you fell on the orange, it ruptured your kidney. That's why your back's been hurting.
Oh no. I don't know if I could go through with the surgery.
Well, there is a robotic-assisted surgery.
Tell us more.
Welcome to the Cookie Channel in partnership with Literacy Connections. I'm Zoe from Girl Scout Troop 1936.
I'm Elizabeth from Girl Scout Troop 1936. Each day this week, we will be sharing a new digital literacy topic leading to National Digital Literacy Day on February 27th. But what is digital literacy?
Digital literacy means having the right digital skills to achieve your goals in a world that is always changing. Today we're here with Dr. Pournik and Dr. Leeser. Thank you for joining us.
Thank you for coming.
Thanks for having us.
So what do you do here?
So basically, Dr. Pournik and I'm one of the associate professor in the Transplant Department. So I do transplant surgery.
My name's David Leeser. I'm a transplant surgeon and I run the transplant program at Vidant Medical Center, and I'm the Chief of Transplantation for Brody School of Medicine. Now, this is a laparoscopic instrument, okay? So it's held like this, and it's got a straight shaft, and I can open it. This is a scissors. And that's about, I can't, your hand can do this kind of thing. And that, when we say articulation, we talk about being able to move your wrist around. You got an elbow, you got fingers. You can do a lot of articulating here, and that allows you to do a lot of complex movements. This instrument does not allow you to do a lot of complex movements. So this instrument, if you're talking about a patient, is going to be through the patient's abdominal wall. So I'm going to be able to do things like this, right? But that's about it, okay? I don't have any movement down here where this instrument is working, okay? So what you can do laparoscopically is limited by these instruments, okay? The other thing that happens is if you watch a surgeon operating laparoscopically, they end up doing a lot of this kind of thing and operating like this, and after a time, it actually is kind of bad for your body because you end up holding yourself in very unusual positions for a long period of time. So although laparoscopic surgery has allowed us to do a lot of surgeries minimally invasively and has decreased the what we say is morbidity, meaning the amount of pain and the size of the incisions and those types of things, there are limits to what we can do laparoscopically. And for the surgeon, it's not the most comfortable of ways to operate. So that's one of the things that the robot here offers that laparoscopic surgery does not.
Kidney transplant, if you want to talk about it, is in two sides. Is actual the kidney, which is the size of the fist, everybody's kidney, size of the fist, and usually sitting in the back. But when we do kidney transplant, we don't put it in the back. We put it right above the pelvic bone and sitting right here. And we connect the blood vessel. Usually one blood goes in, is the artery, one blood comes out, is the vein. So we make those connections to the vessel goes to the leg. And there is a tiny little tube comes called ureter, and it goes to the bladder, which making the urine, and we make these three connections. So we made this module, which actually the artery and vein is basically made up by a company which used the cow, which we'll call a bovine carotid. And it's kind of very similar, very close to the human blood vessel. And then we make those connection with those, so it's be very close and very close to the anatomy of the real transplant. And we use this connection because you can see this is a kidney. It's the way it looks like. And we make those connection, and at the end we test it to see if there is a leak or not. And this is the bladder. This is this is synthetic. It is a fiber material, but as closest we can go to the bladder. And this is the ureter. So we made these, and we put it on that platform and practice how to cut and sew and pass those stuff to it. And now I'll show you how we set it up. So I'm gonna put it there, like you put it in the abdomen of the patient, which is this one. Are you guys following what I'm doing? So you see this, the hands working. So now I put my corner stitch. Now I'm playing with the rest.
So as you can see, when he's doing this, you could not do what he's doing with an instrument that was straight.
If you guys want to come here, look at it, sit here and look, you see the three-dimensional. Look at that.
Uh-oh, she's going into surgical training.
You see your hand is articulating.
The recovery time, is that longer for this or shorter?
Shorter for this. So there is another surgery that we have done robotically, which is a ureteral reimplantation, which is the ureter is the tube that brings the urine from the kidney to the bladder. Sometimes where we sew that into the bladder, it gets scarred and it narrows and the urine can't get down. So we have to go back in and we have to take that apart and put it back together. So we used to do that through an incision that's same as the transplant incision. And it would take, well, it depends on the case, but somewhere between 2 and 4 hours to do that surgery. And the patient was usually in the hospital 3, 4, 5 days. And the 2 cases we've done, the patient, one patient left within 23 hours of the surgery, and the other patient left on post-op day like 3 or 4. He had some other issues, had nothing to do with the surgery that we had to deal with. So, you know, in that case, that when you talk about the cost of things, in that surgery, it's way less expensive to do it. Even though the robot is more expensive and there's a lot of costs associated with it, it's way less expensive if we lose 3 or 4 days in the hospital.
This was really cool. Thank you for allowing us to visit you, Dr. Pournik and Dr. Leeser.
I'm Zoe from Girl Scout Troop 1936.
And I'm Elizabeth from Girl Scout Troop 1936.
1, 2, 3.
Peace out, Girl Scout.